It's a strange thing when you think about it. The very industry that's all about healing people, well, it turns out it's one of the most dangerous places to work. It's this huge paradox, and it has some really serious consequences for the very people we count on when we're at our most vulnerable.
So let's really dig into that. Why is this happening? In this explainer, we're going to unpack the kind of unique system of workers' compensation in healthcare. We'll diagnose the complex risks these places face, and then explore some proactive solutions that can actually protect the protectors.
And believe me, the stakes are incredibly high. This number, that's the fine OSHA proposed against a home healthcare company after one of their nurses was tragically murdered during a patient visit back in 2023. It's just a brutal reminder that these aren't just, abstract risks on a spreadsheet. They have devastating real-world costs.
So here's how we're going to break it all down. We'll kick things off by looking at what makes workers' comp so different in healthcare. Then we'll diagnose the risks, write a proactive prescription, check out how smarter care from insurers can lead to way better outcomes, and finally, we'll look ahead to the future of well-being in this absolutely critical industry.
Okay, so to really get our heads around the problem, we first have to understand the system itself. See, workers' compensation isn't just another health insurance plan. Nope, it is a totally unique landscape with its own set of rules, its own incentives, and its own goals.
And this table here, it lays out the core differences perfectly. On one side, you've got your regular group health plan. Its main job? Keeping you healthy at the lowest possible cost. But workers' comp, that's a different beast. It has a two-part mission. First, get the worker healthy. And second, get them back to being productive. It's also mandated for most employers, and it has to cover everything needed for a work-related injury. No exceptions.
And who are the patients in this system? Well, it's the healthcare providers themselves. We're talking a massive range of businesses, from huge urban hospitals to tiny rural ones, nursing homes, outpatient clinics, and of course, the booming field of home healthcare. Every single one of them is navigating this complex system with its own unique set of challenges.
All right, now for the diagnostic part. The dangers these organizations face. You can really split them into two major buckets. You've got the financial pressures that are threatening their very survival, and then you have the very real physical hazards their employees face every single day.
This really shows the two sides of that coin, doesn't it? On one hand, you have this immense financial distress, and on the other, there's the constant threat of physical harm to the people doing the work. The thing is, you can't really separate them. These two risks are deeply connected, and they often feed right into each other.
Let's start with that financial pressure, because it's especially brutal for rural providers. Research shows that nearly half of them, are operating in the red. I mean, just think about that. When you're struggling just to keep the lights on, how in the world are you supposed to invest in top-tier safety programs? It becomes a monumental challenge. And on top of that, the cost of just messing up on the regulatory side is staggering. A 2024 IBM report found the average cost of a data breach in healthcare has shot up to almost $11 million. That's the highest of any industry out there. A single failure isn't just a fine. It can literally put you out of business. Okay, so now let's flip over to the physical side of things. For a healthcare worker, the job is just filled with hazards. Overexertion from lifting and moving patients, that's a huge cause of injury. Slips and falls are a constant threat. And then you've got exposure to all sorts of chemicals, pathogens from accidental needlesticks, and the terrifying growing problem of workplace violence.
And a picture like this, man, it really brings that danger home, doesn't it? One single slip, one accidental needlestick, and a worker could be exposed to life-threatening diseases. The CDC says this happens all the time, when people are disposing of needles or just working super fast or bumping into someone in a hectic environment.
And then there's workplace violence. This is a known and preventable risk. This quote comes straight from OSHA's investigation into that fatal home care incident we mentioned at the start. The key words there, failed to safeguard from known risks. This shows that being proactive isn't just a nice idea, it's a fundamental obligation.
So the diagnosis is pretty clear. What's the treatment plan? Well, it's all about making a big shift, moving from a reactive mindset of just, dealing with incidents after they happen to a proactive one of stopping them from happening in the first place. So let's look at the prescription for building a real culture of safety. Being proactive really starts with asking the right questions before a caregiver even begins their work. I mean, look at this example from a home healthcare assessment tool. Does the first screening check for things like cognitive status, fall risk, medication history? Documenting these details can stop an accident before it ever gets a chance to happen.
And here's another great example.
This time zeroing in on medication safety. It's a non-negotiable. Are the caregivers actually trained on devices like smart pumps? Are the infusion protocols standardized across the board to prevent errors? These are the kind of detailed, systematic checks that protect both the patient and the worker.
Now, for any administrators listening, being proactive also means staying compliant. Here are 5 key steps pulled right from OSHA guidance. Conduct written hazard assessments for every single situation. Build a formal violence prevention plan, and this last one is so crucial. Involve your frontline staff. They are your absolute best source for finding practical, real-world solutions that actually work.
But building a culture of safety isn't just on the shoulders of the providers. The insurance carriers themselves have a massive role to play here. And the really smart ones? They're evolving. They're going from just being the people who pay the bills to becoming active partners and actually improving care. In this quote from a McKinsey report, wow, it just nails the mindset shift that has to happen. It points out that too many workers' comp leaders still think they're in the insurance business, just playing a reactive role. The future, the real opportunity, is seeing themselves as being in the healthcare business, proactively making employees healthier and more productive.
And the key to making that shift is this idea called value-based care. So instead of just paying for the volume of services, how many tests, how many appointments, this model focuses on getting good health outcomes. For workers' comp, the goal is simple: a healthy, productive worker at the lowest combined cost of both medical bills and lost work time. It's just a much smarter, more holistic way to look at it.
So how do carriers actually make this happen? Well, they can team up with employers to test out new prevention strategies. They can focus their data analytics on what really matters, preventing injuries and getting people back to work. They can build their networks of doctors and hospitals based on high-quality results, not just the cheapest rates. And they can experiment with new ways to pay that actually reward good outcomes.
So, when you put all of this together, where does it lead? It leads to a future of well-being. A future where the entire system isn't just designed to react when someone gets hurt, but to actually create a healthier, safer environment for everybody involved.
If you take away just one thing from all of this, let it be this: the health and the success of any healthcare organization is directly, and I mean inseparably, tied to the health and safety of its workforce. It's that simple. You just can't have one without the other.
And that leaves us with one final, crucial question that every leader in this industry really needs to be asking themselves. Is the goal of your system just to manage claims after people get hurt, or is it to build a truly resilient culture of safety where those claims almost never happen in the first place? The answer to that question is going to define the future of care for the people who provide it.